Good morning, everyone. Bonjour à tous. Les derniers temps ont été difficiles pour tout le monde, mais pour certaines familles, les dernières semaines ont été particulièrement déchirantes. A few days ago, we lost 13-year-old Emily Victoria Viegas to this virus. Earlier this month, it was a toddler who hadn't yet turned 2. And tragically, they're not the only children who've been taken by COVID-19. As a father, I know there are no words for the parents' grief. To Emily's family from Brampton, and to the family in BC, and to all parents who've lost a child, and to everyone who's lost a loved one, we are thinking of you. We are grieving with you. And you are not alone. Le virus fait déjà trop de victimes. On doit absolument l'empêcher à causer plus de décès. La troisième vague continue de se prolonger et à travers le pays, le nombre de cas augmente. Les hôpitaux et les travailleurs de première ligne sont à bout de souffle. C'est le moment de travailler tous ensemble. De notre côté, on fait tout ce qu'on peut pour aider les provinces et les territoires à maîtriser la situation. To beat back the third wave and protect Ontarians, we're deploying federal healthcare workers to the province. This mobilization includes 3 medical assistance teams and 9 critical care nurses from the Canadian Armed Forces. Yesterday, the forces carried out their assessment of the needs on the ground in Ontario to finalize the details of this operation. We're working with our provincial partners on next steps, and Armed Forces members will be mobilized in the coming days. Let's be clear. Sending men and women in uniform to help in Ontario is a serious step. We're doing this because the situation requires it. Today, the first deployment of nurses and doctors from Newfoundland and Labrador will also be arriving in Ontario for the GTA. They'll land this afternoon at Pearson aboard a Canadian Armed Forces airplane. Newfoundland and Labrador is already organizing a second team of healthcare workers who will rotate in to help. Our government is covering the costs of deploying these teams, and we're ready to do the same for any other province or territory that can also step in with support. Unfortunately, Ontario is far from the only place dealing with a spike in cases. Across Nova Scotia, and especially in the Halifax region, numbers have risen quickly, and the province requested help. So we're sending support. We're deploying 60 Canadian Armed Forces members to testing centres in Nova Scotia. This will help stop the spread of the virus. For Albertans, too, we're standing ready. Over the weekend, the regional municipality of Wood Buffalo, which includes Fort McMurray, declared a state of emergency. Yesterday, Minister Hajdu talked to Mayor Scott about the outbreak in the region and the situation on the ground. Our government has reached out to Alberta on what support they may need to keep people safe and get the situation back under control. The bottom line is this. Across the country, we're working with provinces and territories to keep you safe. Across the country, we will have your back. And together, we will get through this. And that brings me to vaccines, because along with public health measures, these doses are key to beating not only the third wave, but the whole pandemic. This week, we'll get almost 2 million doses delivered to Canada. This includes our first shipment of the Janssen vaccine from Johnson & Johnson. Looking ahead, Pfizer alone will deliver 2 million doses a week starting next week, and will continue to work hard with manufacturers to deliver a stable and growing supply of doses to provinces and territories as they plan vaccination clinics. When it's your turn, make sure you book an appointment to get your shot. Sophie and I got our first doses of AstraZeneca on Friday. We're feeling great, we're feeling more protected, and we're also feeling like we're part of the solution going forward. I want to take a moment to do something I don't often do from this stage. I regularly are talking about our seniors and our young people. I want to take a moment to talk about my generation. over the past number of days, we've seen vaccines made available to people 40 years old and up, and that means Generation X has stepped up and stepped out to get vaccinated. And I want to thank everyone who's been stepping forward and signing up and enthusiastically moving forward. Keep it up. Because of the high uptake, because of everything everyone's doing to get more doses into Canada and into arms, we're now second in the G20 in terms of vaccination doses, and we're going to continue. So thank you to everyone for doing their part. D'un bout à l'autre du pays, les infirmières, les médecins, les pharmaciens et le personnel paramédical travaillent jour et nuit pour veiller à ce que le plus grand nombre de gens possible se fassent vacciner le plus rapidement possible. À tous ceux qui contribuent aux efforts de vaccination, merci. Vous faites un travail incroyable. On travaille sans relâche pour vous fournir autant de vaccins que possible, le plus rapidement possible. Si on regarde le taux d'administration des vaccins, c'est-à-dire le nombre de doses administrées par jour par rapport à la population, le Canada se classe régulièrement au deuxième rang du pays du G20. Notre objectif est d'assurer votre protection et celle de votre famille et d'en finir avec la pandémie le plus rapidement possible. La lutte contre la pandémie est notre priorité absolue. Et pour arriver à vaincre ce virus, il faudra l'éliminer partout. We've all seen the heartbreaking news from hospitals in India that are unable to keep up with the number of patients. Earlier today, Minister Garneau spoke with his Indian counterpart about how Canada can best help, including through the donation of extra medical supplies. We're also ready to provide $10 million through the Canadian Red Cross to the Indian Red Cross. This will support everything from ambulance services to buying more PPE locally. If you want to donate to the emergency efforts on the ground, go to redcross.ca. I know many Canadians are also concerned about rising cases in Pakistan. Minister Garneau will be speaking to his counterpart from Pakistan later today about the situation and what we can do to help. As a world, we are in this fight together. On espère qu'on est à la dernière phase de cette pandémie. C'est pour ça qu'on doit tenir bon et se protéger les uns les autres un peu plus longtemps. Chaque fois qu'on garde nos distances et qu'on porte un masque, on se rapproche des jours meilleurs qui nous attendent, quand on pourra manger entre amis sur une terrasse ou organiser un grand barbecue familial dans la cour arrière. Et pendant qu'on continue nos efforts, on doit veiller à ce que les gens puissent non seulement traverser cette tempête, mais aussi revenir en force. As we face a she-cession, a recession that disproportionately affects women, we cannot allow anyone to get left behind. That's why, a week ago, we introduced our progressive feminist plan for recovery. So what does that mean for people's lives? Well, for women entrepreneurs, it means almost $147 million to help with financing, mentorship, and training. This is about investing in the kind of entrepreneurs Minister Murray will sit down with today from BC, and the Deputy Prime Minister will speak to from the 51 in Alberta. I know Minister Monsef will also be speaking with women-owned businesses from Toronto about what they need to thrive too. Women-led small businesses strengthen communities and are the backbone of our economy. For mothers, this plan means making sure you have good, affordable childcare to balance work and kids. And I know this will come up when Minister Gould speaks to women business owners from Windsor about our plan to reach $10 a day daycare across the country in the next 5 years. Pour toutes les femmes, dans toutes les régions du pays, il faut adopter un plan féministe et progressiste pour l'avenir qui vise à assurer la sécurité de tous. C'est pourquoi on va de l'avant avec le tout premier plan d'action national pour mettre fin à la violence fondée sur le sexe. Plus tôt aujourd'hui, la ministre Bibeau ainsi que les députés Brière et Bessette ont rencontré différents groupes de cantons de l'Est pour discuter de notre plan et des manières d'assurer la sécurité de tout le monde. La dernière année a été très difficile, que vous soyez parent, propriétaire d'une petite entreprise, étudiant ou personne âgée. mais de meilleurs jours nous attendent. Et grâce à notre plan, on va créer de bons emplois pour la classe moyenne, rebâtir une économie propre et résiliente et bâtir un Canada plus juste pour tout le monde. Merci